Good morning, everyone. My name is Nurse Davis, presenting from the Montego Bay Community College from campus, Allied Healthcare Level 2. This morning, I will be performing a full skin assessment on my patient and carrying out a glucometer testing. First, I've washed my hands and I've already applied my PPE, and I've gathered my equipment, which are my flashlight, sanitizer, wet and dry cotton, lancing device, glucometer, and my strips and my sanitizer. So first, I will be inspecting, I will identify my patient by the bracelet on her arm and introduce myself. So my patient is Miss Aisha. So good morning, Miss Aisha. I'm Nurse Davis, and this morning I will be performing a full skin assessment and carrying out a glucometer testing. Is that okay with you? Okay. So I've lowered my bed wheels, and I just screen. I open my window for adequate lighting because the patient's body wants to see clearly what's happening. So first I will be doing a head assessment. I check her ear for any discoloration, any bald spots or any sores. So her head is okay, her hair is fine. I check behind the ears to see if there are any sores, and I do both ears. And I'll check her eyes for any discoloration. Any discoloration of her eyes could be cancerous. I'll check her mouth. I'll remove her mask, and I will use my flashlight to look inside of her mouth, along with a foot stick just to hold down her tongue to get a full view. Can you open? So I'll check for any sores, any redness, and any cavity. So her mouth is fine. So I place back her mask. I check her neck for any chafing, and because my patient is bedridden, I check because the tube can let her chafe and all of that, and I check also behind the neck. So she's perfectly fine there. I'll check under her breast now to see if there is any redness or any sores due to perspiration. So under her breast is looking fine, no form of chafing or anything. I check my patient's elbow, the back of the elbow. I check for pressure sores because behind the elbow can have pressure sores because of her getting up in the bed, pushing, so friction can cause bed sores. I check her fingers for any deformities, any discoloration. Her finger is fine. And I check her abdomen if there is any lump or anything. Miss Aisha, are you feeling any pain? Okay, so I'm going to do the lower extremities now. So I'll apply my back blanket for privacy of my patient. While doing so, I will unfold the sheet to the foot of the bed. So unfold my sheet to the foot of the bed. So I will check my patient's knee. I'm going to check the knee for any scars due to surgery, due to any operation done on her knee. I'm checking for swelling. I'm checking behind the knee for any pressure sores. Her knee is fine. I go down to her ankle. I check the ankle as well for swelling. I check the toes for any deformities, and I also check the heel. With this, I'll be using a mirror to check the bottom of her feet, to see if there is any sores, So she's okay, her feet are fine, and I do both the feet. So now I'm going to apply back the sheet while I remove my back blanket. I bring my back blanket back to the designated area, ensure that she's okay in bed. So Miss Aisha, are you okay? Are you feeling fine? So now I'm going to carry out the glucometer testing. So I get my lancet device and I get my strips and my so before that I'm going to sanitize patient's finger, sanitizer and due to the pandemic. But first I am going to ensure that I massage her finger just to get the blood down into her finger so I can get full blood. So I'm going to use a lancet device. I'm going to gauge it at 5, so I'm going to prick patient's finger. Okay, so I'm getting as much blood that I need. I'm going to use the glucometer with the strip and I'm going to the blood. Okay, now I'm going to place some cotton on her finger, ask the patient to hold, put pressure on the finger. So now I am going to record the reading. Okay, so my patient's reading is 4.2 and this is normal for a diabetic patient. So I'm going to clean up my work area and I am going to remove my PPE. I'm going to lock bed wheels, bring back railings up and I'm going to put that bed to normal position and that's just about it. I check on my patient if she's okay. So Miss Aisha, are you okay? Are you comfortable? Okay, so what I've just performed is how to treat a bedridden diabetic patient and also carry out a glucometer testing. So that is how I do it, guys. Thank you.